Vet case study. The sneezing cat. This Be Kind to Pets veterinary educational video shows how the 8-year-old male cat with a swollen right face and right upper gum is diagnosed by Dr. Thathamu Kia in Yangon, Myanmar, using laboratory aids to diagnosis. These are X-rays and FNAC, or fine needle aspiration cytology. X-rays of the skull. Lateral and ventrodorsal views were done. The lateral views included the right and left side of the nasal area. They showed the large soft tissue mass clearly on the right side. See the two red arrows. The left side has no mass. Ventrodorsal view confirmed the mass was in the right nasal passage.
The second laboratory aid to diagnosis was a FNAC, or fine needle aspiration cytology. Dr. That inserted a fine needle into the swollen upper right gum to extract tissues and cells, which were examined by the laboratory. Malignant cells were reported.
As veterinary costs will increase, no blood to stand tissue biopsy were performed. Tissue biopsies preferred to FNAC, but this procedure would cost more.
The consent of the owner is needed for tissue biopsy. It would tell via histopathology whether the nasal lump was cancerous and what type of cancer it was. In conclusion, X-rays were excellent as they show very clearly soft tissue mass inside the nose. Excellent. X-rays make diagnosis easier.
A very big thank you to Dr. Thathamu Kia for collaborating on this interesting vet case study with Dr. Singkong Yuan.
Thank you for watching.